prevent diabetes, how to treat it, and we'll talk a little bit more on that subject. I want to thank our co-host and our master and our mentor, Dennis Chen. I myself, I'm Dr. Grant Schneider. I'm a chiropractor. I've been practicing 28 years, and I practice in Livonia, Michigan. Let's see. Today we want to talk about natural health. We want to talk about not taking prescriptions or trying to avoid prescriptions if we can. We want to talk about how supplementation might help and benefit us. And we're just looking to live life in a natural and healthy way. So our speaker today is Dr. Nathan Benning. Dr. Nathan is a MD and a PhD. His specialty is internal medicine. He's done some research at UCLA on tumor cell research. Let's see, he's done some work at Duke University on cancer cell research, Wright State University cell aging research, University of Michigan nutritional research on declining diseases in the elderly. And he's been in clinical practice for 30 years. I know Dr. Benning. I've been to his house. I've shook hands with the man. He's a very sharp and knowledgeable and an impressive man. Please welcome Dr. Nathan Benning.
Welcome, welcome.
Oh, thank you everybody. And I see you again since last time I gave a talk. So today we're going to talk about diabetes prevention or treatment or more. So I'm pretty much sure everybody already know whole lots of diabetes. And I have always to say diabetes just like play a poker. It's easy to learn and difficult to master. Okay, up to now, I'm still learning how to treat, how to prevent. Okay, so I hope today's talk, and I will give you aspect and the look of the diagnosis and treatment, especially treatment in the more natural way than the traditional medications. So let me start just say what is a diabetes. So diabetes is deregulations of blood sugar in your body. If it's not under control for over a period of time, will cause severe consequences of your health. So I just pulled this one out from the CDC. It's about 1/3, which is 30 million people in the United States diagnosis of diabetes. And among that, one of the 4 people do not even know they have diabetes. That way are very common in the practice. I can see people come over here, they didn't know they have diabetes, and they have a variety of symptoms. Then we eventually made a diagnosis. And also among almost about like 25% of the United States, the population, we have pre-diabetes, so which is almost 86 million people. So that's quite a lot. And the cost for treating all those people are enormous, which is like almost $250 million, $1 billion. And people have a diabetes, diagnosis of diabetes have increased the mortality rate about 50% higher than your healthy counterpart. So let's see what is the diabetes. So what's the symptom we have? Most of the time people have like kind of tired, fatigued, and thirsty, urinating a lot, losing weight. So that's a typical diabetes, the symptoms. But most of them, again, that's why we have lots of people don't know, is that have the asymptomatic. So that is very important to remember. Lots of people, either pre-diabetes or diabetes, are symptomatic. Now, how do we diagnose the diabetes? And also, again, I pull this one standard from the CDCs. Now, there's 3 things that we can do to make a diagnosis. One is called hemoglobin A1C. And if you are below 5.7 and you are normal, if you are between 5.7 and 6.4, and here, and you are pre-diabetes, and if you're above 7.5, I usually do like a 2 occasions, two times, and you diagnose have diabetes. Now, the second diagnosis is simple, just check your blood sugars. Now, this one is not check your blood sugars, let's check your hemoglobins in your blood. So this one's straightforward, check your sugar levels. If your sugar levels below 100, which is normal, 100 to 125, you're pre-diabetes, about 126, almost 130, 2 times, you can consider yourself have diabetes. So the last one is more in the office doing the called a glucose intolerance test, which is they give you 50 milligrams preset sugars and they check your sugar level 2 hours after. If you any time of the test, if your sugar level about 200, you diagnose as diabetes. Now there are some risk factors to determine people have diabetes versus non-diabetes. So some of them modifiable, some of them is not. Say, for example, you're pregnant, you're overage, advanced age, your race, your family history. That you cannot change. So we don't worry about that part. Of course, diabetes patient we have to be really, really careful not getting pregnant. So there are lots of the factors you can control, which is physical activity, reduced weight, poor diets, and high blood pressure. Smokers can produce or increase your risk to become diabetic. So now I'm always getting asked, so to me say, when I have a diabetes, when you diagnose that you have a diabetes, which organ my body's failed? Lots of people say, oh, of course, the pancreas. Now you can see here, yes, if you ask an endocrinologist, definitely your pancreas. If you ask a hepatologist, then they said, no, it's your liver problems. Now, if you ask a gastroenterologist, they say, no, that's your intestines. Now, if you ask a psychiatrist, they said, no, it's your brain. Your brain causes the problems here, dysfunctions, because you have lots of stress, your cortisol overproduced, your epinephrine is overproduced. That's prone to you to become increased blood sugars, then you have diabetes. Of course, the capitalists say, you are too lazy, you are too fat. That's cause you have diabetes. The communists said, oh, no, you are too lazy, you are not working hard enough, your muscle not use enough glucose. Now, there's one group of people I did not list it here, is a nutritionist. And they said, oh, no, it's all of those. Okay, so I just remember all of the organs involve your sugar metabolics. Now, when we have a diabetes, now why are we so worried about diabetes and what's the problems and the consequences if we don't treat the diabetes? Most of them would eventually have a stroke, and you have a heart attack, and you have retinopathy, which is blindness, and kidney failure, which could cause you have dialysis, and peripheral neuropathy, and cause you have amputations. So that's a list on the side here of complications. One thing I did not list here on this picture is called a ketone acidosis. Usually it's like untreated type 1 diabetes and has a sugar level extremely high. Those patients are acutely need to be taken care of, need to be hospitalized and treated. Remaining of those complications are chronic, and most of them are involved of blood vessels. So the bottom line of pathological complication for diabetes is your blood vessel problems. Now I have this pictures here. It looks very complicated. I don't want you to read all the here. I just want to point out a few things here. One is the collagen. Okay, well, let me just put it this way. This is our blood vessels, the wall. 3 layers, and we have endothelius, intima, and media. So 3 layers. And some of them, the collagen in the intima and the medius, and also endothelial cells, which is lining that they didn't point well. The lining of the blood vessels. When you have high blood sugars, what causes the problem of your blood vessels? The mechanism right now that lots of people propose is that the sugar levels can cause endothelial cells damage, collagen damage, then eventually lead to your cholesterol accumulate in your blood vessels, and they cannot damage the surface of your blood vessels, and the cholesterol and the platelet very easily to stick to the blood vessels, then eventually cause blockage of your blood vessels. So think about if you have a perfect, very smooth lining of your surface, lots of stuff cannot be easily attached to it. Just like you have a cooking pan, you have a very high, expensive one, nothing going to attach to it. Same as our blood vessels. So high sugar levels cause the damage of endothelial cells, weaken of your collagens, and the causes and smooth of your blood vessels. And consequences and your cholesterols and the platelets and accumulate into the cell, into the blood vessel and cause the blockage. Now, so that's just kind of a summary of what that picture said. When you have a high blood sugars, and what happened, the blood sugar cause called oxidative stress, which is cause the damage, inflammation to the inner lining of your blood vessels. Once the blood vessel damaged or inflamed, they trap in the cholesterols and form the clot, cause blockage of the vessels, then subsequently cause the blockage blood flow. And therefore, then we have all those complications, long-term complication of kidney, eyes, heart, brain, and legs. Now, what are we going to do when we have diabetes? Okay, so that's the 7 easy step. Okay, so most of people already know eating healthy, be active, exercise regularly, monitor your blood sugars, and reduce risk, which is smoking and overweight, and psychologically coping well. And that's what we're talking about. Your brain is part of dysfunction of diabetes regulations. So you have to coping well, understand the nature of diabetes. Think about you are able to deal with it. You can beat it, beat the disease. Now, this one here, we're talking about taking medications. Obviously, you have to see a doctor and prescribe the medications. Now, my purpose of the talk today is not ask you to see a doctor to take the medications. My purpose is that try to have you not see a doctor, because whenever you're taking the medications, they all have side effect. And also you might have to take them for the rest of your life if you don't change anything of your lifestyle. For example, we call it hypoglycemic, which usually involve type 1 diabetes or certain people type 2 take insulin. That is also very dangerous situations. You need to be hospitalized because you're getting confused and you're going to have sudden problems. Same thing as called lactic acidosis. Most of people already know you take metformin and glucophage, that could have lactic acidosis when your BUN creatinine level slightly increase, and the doctor will tell you to stop. Some kind of GI effect, nausea, diarrhea, and cardiac arrest. So I don't know the people in the United States. The Actos is the diabetic medication, has been on the market for the last 20 years. And somehow they have a big warning signs on the Actos and the lawsuit against the manufacturers. They have caused some cardiac risk, okay? And also pancreatitis, such as Januvia, certain other medications. So let's talk about, let's look at what happened to it, all the medications. As I showed you earlier, so the diabetes is multi-organ failure, and the doctor is really smart and very genius. Maybe not doctor, maybe scientists. Okay, so I'm taking lots of credits. Okay, for example, they can develop some medications to treating your gut. They also make medications treating your pancreas, like say, for example, give you insulin, and which can regulate your sugar levels. And I just read the latest medical articles and the Stanford universities. They think your pancreas, which is like a beta cells produce insulin. Beta cells produce insulin. Alpha cells produce glucagons. So they found out glucagon is increasing sugar levels. And they found out that the people have diabetes, their alpha cells is dysfunctions, and they produce excessive amount of glucagons. Now, when you have a glucagons, and they can tell your liver to produce more glucose, sugars, and then release the blood vessels, then your sugar level increase. So all those steps, all the organs are involved of regulates of blood sugars. So all of those are important. So let's looking at first the things here. Now, we are not talking about the medications. We are talking about some other means of regulates this problems here. Now, the intestine has two peptides, two proteins called secretins. So when you're eating your food, okay, so your gut cells produce those two peptides. They signal your pancreas, and one is tell the beta cells to produce more insulins, tell your alpha cells to reduce glucose, which both acting on the livers. And the liver say, okay, I will shut down the production of the glucose. So either of those dysfunction can cause a problems. Now, we're talking about not medicines. What are we going to do with your gut? As a matter of fact, lots of research point out the gut has this called probiotics. The probiotics and can regulate those two proteins. And also the probiotics can increase your body sensitive to insulin. So you have insulin, your muscles, your livers more sensitive to insulin, even though you have a slower dose of insulin. Probiotics also change your gut cells into insulin secretion cells. So actually the gut can make some insulin. Very small dose of insulin can change your balance of your sugar levels. The last things I also looking at is probiotics help you losing weight. As we talked about, reduce the weight will better manage your diabetes. So probiotics can reduce your weight. Now, my wife, Lucy, they have recently studying this weight reduction, the group. they have been using the probiotics. Now, I might just give you additional information how the probiotics help you reduce the weight. Now, find out, as I said before, the probiotics in your gut can increase those two we're talking about. It's called a GLP-1. Those two proteins increases, they can cause you reduce your appetite, and you have a satiety, the feelings. That means you're full. You don't want to eat some more. So that's why you have reduced the caloric intake and the reduced weight. Then secondly, the probiotics also reduce the dietary fat absorptions. Now, how they do is that they change the bile salt, which is produced from the livers, and the dissolved bile salt. When the dissolved bile salt, the bile salt is helping you to absorb the fat into your bodies. So when you reduce bile salt in your gut, and therefore your absorption of high caloric compound fat into your bodies, you're losing weight. The third thing I thought was very interesting is called internal combustions. The more calories and goes out of your pipelines. What that means is when you have a proper the probiotics in your gut, they burn internally lots of calories. So I don't think that's just the promoted too much that people say, okay, I just take it probiotics, I sitting there, they burn the calories in my intestine. But it does. That's why they also help you to losing weight. Now, USANA, the company, they make the very good probiotics. They have the package they have is like 12 million billion the bacteria, colony forming bacteria. Is high quality, the pharmaceutical grade, consumer lab approved the probiotics. So my wife, their losing weight group has been recommended to taking this supplement for their weight loss product programs. Now we move down the different organs. We're talking about the liver functions. Now, as we talked about earlier, so most of people, if you have basic biology or in school, you're probably easy to understand these pictures. It's your liver here. It's the end target of all the sugar regulations. So when you have a high blood sugars, they stimulate insulin, promote insulin release. And so insulin release, they make the sugar storage into the glucose, into the livers, and also the tissue cells, that's the muscles, the fat. And also when high blood sugars cause you reduce your glucagons, which is reduce the production of glucose in your livers. So on the other hand, when you have a low blood sugars, that will reverse the pathways. So that's why your liver is also extremely important organs for you to taking care of it. And it's an important function in your diabetes control. Now, I showed these pictures before. So you have high blood sugars cause oxidative distress, oxidative stress, and cause inflammations and cause the damage of the inner lining of the vessels and cause trapping the cholesterol and the plaque forming and block the blood vessels, block the blood flow. Now, what do we need to do? Of course, simple. And logically, we control the blood sugars. That's why either through your diet control, medications, exercise, and number one, and we need somehow we're taking lots of antioxidant supplement, which is to reduce the damage of your lining of your intestines. So they reduce oxidative stress, reduce inflammation of your blood vessels. So high antioxidant supplement, good quality antioxidant supplement is also have an important role in diabetes regulations. The third one, we'll move down. And when you have cholesterol trap and plaque forming in your blood vessels, and at the earliest stage, you can start taking some supplement, like say fish oil, high quality of omega-3, fibers, which is sometimes to help you to, some data show the reverse the plaque formations. Of course, if your disease advanced too much and you want to see a doctor. Now, doctors here have a very crucial rule that here to help you. Obviously, you can hear people said they can put a stent in there, they can do bypass surgeries. That is a doctor's rule. So, but hopefully we don't get into that stage. Doctor also has some limitations. When the blockage is too bad and too severe, what are you going to do? Doctor, nothing. So you don't see doctors anymore. You see morticians. That means you're dead. You're going to have mortalities. That's why. That's very, very important for us to understand when and how you can control the diabetes, what you can do, what doctor can do, and to control this deadly disease. Now, here is USANA has. USANA has very high quality minerals and antioxidants. Those medications, the supplement is to help you to reduce oxidative stress damage to your blood cells. And so that's why we always recommend people, minimum healthy person taking the multivitamins, high antioxidants, and the core minerals. And also the HepaCell, which is another product from the USANA, and they help your liver functions. And I have been very fond of this supplement. They help me to treating some conditions such as fatty livers and liver functions, and people even on the liver transplant due to alcohol use. Somehow they delayed or even postponed of the liver transplant. So other supplement USANA provide is fiber genes, which is provide you high the quality of fibers, and you can take, and in addition to other few the supplement I recommended. Now, so what is the take-home message? The take-home message is diabetes is a multi-organ failures, not only one, not just say pancreas, not as some people say it's livers, it's multi-organs. And so therefore, when we treating or manage of diabetes, and we have to consider all different organs. Now, second take-home message is, before you talk to doctors for the treatment of diabetes, talk to the nurses. So they are the one to put the bar higher for you to enter the hospital, enter the doctor's office, to preventing you to go over there. That's most of a natural way to have the diabetes. Of course, you can have other forms of people help you, such as like the personal trainers and different people to psychologists helping you dealing with your stress. But please talk to your own nutritionist. Okay, so that's pretty much the one I would like to talk about. So that's the last things that I'd like to thank my wife, prepare most of the slides for me. And I do not want to talk too long, and because I know everybody have some other questions, and most of people already know most of issue of diabetes, but that's I try to point out a few things for you. And another homework is that think about the question, how you're going to answer it. I'm not going to answer it. My wife won't let me answer it. Is doctors versus nutritionists. Now, who is a smart and who is a genius? So think about how we're treating diabetes, how we handle the diabetes. So you can go home to think about it. And so how we manage the diabetes, that's the different approach, and doctors versus nutritionists. Okay, so that's I'm just talk to now, and I think that I'm talking very fast today, and 34 minutes. Okay. So Graham, so that's pretty much it. Anybody have any questions, any concern of all those slides here? And welcome to ask it.
Well, Dr. Benning, what a great presentation. You really helped us to understand diabetes. I think for many folks, it's just a medical term that has to do with sugar and the pancreas. And I think a lot of people don't really understand it on a cellular level. And you took it right down to that cellular level. And you helped everyone to understand how it's not just the pancreas, but it's all the organs and your whole body that has to do with staying healthy and preventing that disease. I think you helped everybody to understand how supplementation can benefit and how USANA can benefit. I would like to open it up to some question and answers. Please, if you could enter your questions in the chat, but if you could just direct the questions to me so that not everyone can see your question. What I would like to do is I would like to take two questions first, and then Dennis Chen wanted to speak for a few minutes. So we'll do two questions first, and then we'll give Dennis an opportunity to speak. Dr. Benning, there's a question that has to do with blood sugar and cholesterol. So maybe my blood sugar numbers improved, but then my cholesterol numbers went the other direction. Is there any connection there? Can you speak to that at all?
In terms of the cholesterol levels directly, is not significantly related to it. Most of the time we do see the people have almost a parallel result. Basically, they're watching the diet, they improve the gut functions, and the exercise. So when they have reduced the sugar levels, the cholesterol level tend to be also lower. Now, then there is another fat in your blood is called a triglyceride. Now, sometimes that is sometimes I see slightly independent than the sugar controls. And that has lots to do with the genetic component. Lots of people just, no matter what you do, what you dieting, the triglyceride is extremely high. So that's the only cases I see is not directly related to sugar controls.
Yeah, sometimes not everything makes sense. We can do good things and benefit one area, and then we're not sure why the other area gets out of hand. But still, we have to look at the overall person and try to solve all the problems, sometimes one at a time.
That's correct, because as I said earlier, diabetes, all diseases, we know a lot about the disease, but we still don't know a lot of them. So we're still learning. So the research and the treatment is still coming.
Okay, here's another question. So when I was young, we didn't worry so much about germs. I mean, we drank out of the garden hose, for crying out loud, and we didn't focus so much on washing our hands, and we weren't quite so sanitary. And it seems like now that we're focusing more on all of these sanitary issues, but people are still getting sick. Can you speak to that? Is there a connection between how sanitary we are and how our overall health is?
Well, in terms of sanitation issues, certainly we are limit. Well, in terms of diabetes, we are too clean, and so they changed the population of our gut. In addition, also we overuse of antibiotics, so they change your gut environment. There are lots of research indicate that healthy gut and certain population of the probiotic in your gut can improve your immune systems and also can improve your diabetes. There are some research indicate there are two distinguished type of the balance of bacteria in your gut. Actually, they found out people overweight, obese, and the diabetic patient has one particular the bacteria versus the other one. So, and also the immune system can be improved by supply the proper probiotics, because we don't get enough, and we don't get enough variety of probiotics in our diet, and so immune system reduced. So we are too clean, and our body do not produce enough like antibodies, and such as like best example is when we used to have a natural birth, and the baby's getting probiotics, the good bacteria from mother's vagina canal. And now we do a lot of C-sections, and then those people tend to be more prone to have asthma and infectious diseases. And so there is actually some OBGYN even try to swap the good bacteria for the mothers and sticking to the baby's mouth, and so they kind of help, hoping that's the improve your immune systems.
Yes, it almost seems like there's an epidemic of C-sections lately.
Right, because I don't know.
It's a strange thing. Also, in chiropractic, sometimes we talk about the seed versus the soil. So the seed would be the germ or the disease, and the soil would be you and your body. And a lot of people want to blame sickness on the seed or the disease or the germ, but maybe it is how our body is our soil fertile for that germ or for that seed. And if we can take care of ourselves and make ourselves stronger and improve our immunity and our overall health, then we are less susceptible to getting sick. Let's see, I think